Jerry Calderon. Thank you for joining us today. Today, I'd like to introduce to you Lamaze. But before we go and join our happy couple in Lamaze class, I would like to give you some background history of childbirth in the United States. In 1951, Dr. Fernand Lamaze introduced a method of childbirth in France by incorporating techniques that he observed in Russia. In the late 1950s, word of mouth of this method spread quickly to the United States. This method consisted of childbirth education classes, relaxation, breathing techniques, and continuous emotional support from both the father and a specially trained nurse. And this became known as the Lamaze method. As a result, in 1960, the ASPO and Lamaze was formed, which is now today known as Lamaze International. Lamaze International is a not-for-profit organization. It is composed of parents, child educators, healthcare providers, and other health professionals. All of these entities have provided support for the Lamaze method and have been successful in spreading the word about Lamaze and to set standards for Lamaze childbirth educators. What is Lamaze today? Well, 40 years of research and learning from women's experiences of normal natural birth have provided evidence that has gradually and dramatically changed Lamaze from being just a method for giving birth to a philosophy that provides a foundation and direction for women as they prepare to give birth and become mothers. Breathing is no longer the hallmark of Lamaze. The Lamaze philosophy of birth is at the heart of Lamaze education, and it has been for nearly a decade the driving force for significant changes in Lamaze preparation for childbirth. The Lamaze certified childbirth educator promotes, supports, and protects every woman's right to give birth. She's confident in her own ability and free to find comfort in a wide variety of ways, and supported by her family, friends, and all members of the healthcare team. So now that we have a little background history, let's move on to the Lamaze class in session. Okay, thank you.
I'm Anne, and I am the Lamaze instructor, and I want to welcome you to Lamaze. Today I have Mr. and Mrs. Black, and Mrs. Black is expecting her first baby. How many weeks are you, Mrs. Black?
36.
36 weeks. Well, we're going to begin with talking about the cycle that occurs when a woman goes into labor. Now, when a woman first goes into labor, obviously some fear begins. She may have fears from things she's seen in television, from family members. So it starts with the fear. And once she gets fear, she begins to have tension. And the tension goes in the muscles. And then the muscles aren't getting as much oxygen. And with not enough oxygen, she feels pain. So the pain increases. Now, what we're trying to do with Lamaze technique is decrease the pain, or the cycle begins again. Does that sound like a good idea to both of you?
Yes.
Next, we're going to be talking about the birthing ball. Hello, we're back, and we're talking about the birthing ball. Mr. and Mrs. Black, are you familiar with the birthing ball?
No, we're not.
You're not? Well, it's a wonderful thing. It's going to aid your labor. It's going to aid your labor in using gravity, allowing the baby to move down, which will even speed up the process. Would that be good for you?
Yes.
Oh, yes, of course it would. Yes. All right. Well, next, I want to demonstrate how you would apply pressure on the back of her back,
Okay.
on the lower part of her back, excuse me.
Right here?
Yes, during contractions.
Okay.
That can help to alleviate some back pain.
Okay.
Being on the ball helps alleviate pain, helps with her discomfort, and as I said earlier, it hastens the labor, or it can hasten labor. All right.
She gonna be rocking?
She could shoot. That's exactly.
Okay.
You're right before me, Mr.
Yeah.
Black.
Okay.
Remember, rocking back and forth or front and back can help when she's having contractions. But it's important to adhere to the safety measures.
Yes.
While she's on the ball, her coach, Mr. Black, needs to stay around the ball, either in the back or front, to ensure her safety, because she could fall off the ball. Did you want to fall off the ball?
No,
No.
you better hold on
So
to me.
don't forget about your safety on the
Okay,
ball.
Okay.
Next, we are going to be speaking about breathing techniques. We're back, and now we're going to talk about breathing techniques. Are you guys familiar with breathing techniques?
No, not at all.
Well, big part of Lamaze are the breathing techniques, okay? It's important with the breathing techniques. It allows adequate oxygen into the muscles to the uterus, and oxygen for the baby, which is really important, okay?
Okay.
Breathing and relaxation also helps alleviate some of the pain by you focusing on your breathing, and it's not going to completely take away the pain, but it will help in dealing with the pain. Also, next we're going to be talking about the first thing we do with our breathing is called a cleansing breath. Now, a cleansing breath is done at the beginning of a contraction and at the end of the contraction as well. Now, I'm going to demonstrate it for you. First, you're going to breathe in, and then you're going to breathe out. And then the end of the contraction, you're going to breathe in, fill your lungs up, and breathe out. And empty them completely. Very good. In through your nose and out through your mouth. Can you demonstrate that for me?
All right.
Begin, now an end. Excellent. Now another thing that helps is a focal point. Then you can use an object to focus on at the beginning of your contractions. As soon as the contraction begins, you start with your cleansing breath and you look at your focal object. Now, we thought this would be a good one. Will that work for you?
Yes.
Okay, so we'll put it right here. And once we do the cleansing breath, we start with the breathing in between. Now, we normally breathe 16 to 20 breaths per minute. But when we're breathing during a contraction, we're going to use 8 to 10 breaths, so half of what the normal rate is, okay? Now, in the active part of labor, you want to do a breathing technique that kind of sounds like a cat. And as you're into transition, you're going to go with more of a, okay? All right, so we're going to pretend a contraction's beginning. Contraction begins, and we take in a big, deep cleansing breath, and out. You're looking at your focal object here, and you're going to breathe. He. Okay, contraction ends, cleansing breath. Now, when we're in transition, let's try a breath for that. Cleansing breath in, focus, and
Good job.
contractions ending, cleansing breath. Excellent. Excellent. Okay, now it's important to talk about the urge to push. And that can occur just at the end of transition or a little bit before. And what happens is sometimes a woman gets an urge to push, but she's not fully dilated and it's not time to push. So we have to stop her from doing that. And by breathing techniques, we're able to stall her from pushing until she's fully dilated. So the best way for that is panting. So when you're panting, you can't push. So just like a dog, demonstrate that for me. Good. Excellent. So now we've learned all the breathing techniques for Lamaze. You've learned how to use the birthing ball, and I think we're ready for labor. Keep in mind that you want to practice 3 times a day so you're all ready when labor begins.
Okay.
Thank you so much for
very
demonstrating.
much.
Thank you.
Thank you so much.
Good job. Good job.
Welcome back. I hope you enjoyed the Lamaze class. I want to congratulate Mr. and Mrs. Black on their pregnancy, and I would also like to thank our educator, Ann. So you are interested in Lamaze. Why else would you be watching this video, right? Well, Lamaze is it. Lamaze is for you. Lamaze supports evidence-based pregnancy and birth practices, and these practices are supported by research and childbirth educators. Lamaze seeks to help build your confidence and ensure that you have the support you need during pregnancy and birth. Lamaze provides strategies for natural pain management during labor and birth, reducing unnecessary medical interventions and helping you to choose methods that are safe and healthy. And Lamaze encourages bonding between you and your baby with the importance of skin-to-skin contact. So push for your baby and join the Lamaze family. If you have any questions, please visit the website at www.lamaze.org. And God bless.